Hi, everybody. We're going to talk about tobacco and vaping in this lecture. So here is our objectives, what we're going to be going over. So here we see that here's a history of tobacco, right? So back in like the 1950s, 1960s, tobacco was thought of as being healthy. Like doctors used to recommend it. They even had dentists recommending cigarettes and which brands to use because it wouldn't stain your teeth. But if you look at the very bottom, it says no filler can remove all nicotine and tars, nor does Viscera make this claim, even though they clearly make the claim that it won't stain your teeth, right? And then here we have a picture of nurses giving soldiers in the hospital cigarettes. And I had my boss when I was working in public health, his mom's friend, when she was in the hospital right after giving birth, the nurse turns to her and says, "Here, take a cigarette. It'll help you calm your nerves and it'll help you feel not as anxious, right?" So they used to hand these out as medical professionals. They used to recommend it. Okay. So, and you can find these images if you go to Stanford, tobacco.stanford.edu. They have all of the past advertisements used by dentists and doctors. Um, and so you can see those. And there, that QR code will also take you to that. So if we look at nowadays, what are we recommending? So e-cigarettes are kind of following the same thing that tobacco did, right? So there's articles out there, doctors defend vaping and recommend e-cigarettes to smokers to help them smoke. Doctors recommend e-cigarettes. Watch this full video here. So when we talk about vaping, though, what we're talking about is the dangers to youth, basically. So when some of these doctors are defending vaping, they're saying it's less harmful than maybe cigarettes for adults. So we'll talk about that later in this as well. Um, if vaping actually does help smokers to quit. So here's some other things that doctors and dentists use to promote, right? So tobacco companies, they actually bought out the food industry, food companies back in the 1980s, and they started to use the same tactics in food to try and sell food like they did with cigarettes. You also see another one, doctors smoke more Camels than any other cigarette, right? Promoting cigarettes. They used to do DDT on kids. They used to have actually heroin in medicines. They used to put asbestos in everything. And then all these things, they found out that they're actually dangerous and harmful, right? So we had to stop using them. You'll learn if you remember from biomaterials, with periodontal dressing, it used to have asbestos in periodontal dressing, right? So there's even things that we use in dentistry that we didn't know were harmful for us back then, and now we know that they are. So here's some tactics with vape, right? So tobacco industry took over the food, add a lot of sugar, bright colors, and now vaping is using those same tactics for tobacco and food to try and sell their vaping products, right? It makes them taste sweet. They have lots of flavors. They compare it to sugary cereals that are targeted to teens and children mainly. But back in 1964, the first Surgeon General report came out, and this is Luther K. Terry. He was the Surgeon General at the time. And this was the first time that they recognized that smoking could be harmful for your health.
The strongest relationship between cigarette smoking and health was in the field of lung cancer. There was a very strong relationship and probably a causal relationship between heart disease and cigarette smoking.
So even here in the Surgeon General report, they didn't come out and say it does cause, right? They said there is a strong relationship too. So we've done a lot of research since then, and now we do know that it is correlating, right? Smoking does cause lung cancer. But even back then, when that first came out, they just used terms like it might cause it. There is a correlation between, right? Because they didn't have all the research yet to definitively say that it does. So when back in 1964, when that first Surgeon General report came out, you can see that the rate of cigarette use was a lot higher. So if you look at men, which is the red line, 51% of men, 33% of women. So average population's 42% of the population was smoking cigarettes at that time. Since then, we've done a lot of steps to diminish that. So now, as of 2020, we're at 12.5% of the population. And then if you look at through the years, some of the major things that have been going on is you have 1964, the first Surgeon General's report showing smoking can be harmful. 1973, Arizona was the first state to restrict smoking in some places. 1988, this is when the Surgeon General's report does conclude that nicotine is addictive. 1990 is when airline flights were smoking on airlines were banned. 2009 was the biggest federal tobacco tax. So, raising tobacco tax is a known public health tactic um, because the more expensive the product is, the less likely people are to use it. And then they do use those tobacco taxes to help people who are quitting or who are smoking to quit. So all of your tobacco quit lines for the states, that is paid for through the tobacco tax. Also, a lot of, depending on the state, but those funds could be used for other things like social programs or education, things like that. And then in 2019, the federal minimum age was raised from 18 to 21. And that was important because in the high schools, there's still a lot of 18-year-olds who could legally purchase tobacco products. And so they would purchase it for their friends, pass them out to their friends in school, or sell them to other high school students who couldn't legally purchase it. So by raising the age to 21, they limited the amount of tobacco products that were able to get into the high schools. So cigarettes, the people who use cigarettes now actually have a greater risk for lung cancer today than they did in 1964. And that's because of the way cigarettes are designed now. So if we look at this picture here, now we have the filters on cigarettes, right? And the filter is supposed to help take out some of the harmful chemicals, right? Filter it out of the smoke. But what it actually does is it causes the user to inhale even deeper to get the smoke through the filter. So what's happening is that smoke is going deeper in their lungs, and the bottom part of the lungs, where the nicotine gets to, is actually absorbed in the body faster. and it makes the cigarettes more addictive. Um, you also have these little ventilation holes that are strategically placed on the filter. It's supposed to allow in outside air into the filter, but it's placed where either your lips go or your fingers go to hold the cigarette. And so then those little holes get closed by your fingers or your lips, so the outside air can't come in. You also have, like, when you burn a cigarette, all of it's burned, right? So even the cigarette paper that the tobacco leaf is rolled in, it has a lot of chemicals in it. And so those are burned with the tobacco, and then that is also inhaled. It also has a lot of additives. So they add sugar, flavors, ammonia. They have bronchodilators, right? So bronchodilators, what does that do? It's going to dilate your lungs, allow more of that smoke into your lungs as well. So we're going to talk about other tobacco products that are out there as well. So cigars, one large cigar has 10 times more nicotine, 2 times the tar, and 5 times more carbon monoxide than cigarettes. So one large cigar contains as much tobacco as a pack of cigarettes, right? And it usually takes about 1 to 2 hours to smoke. So if you think of it that way, if somebody who smoked cigarettes smoked a whole pack in 1 to 2 hours, that would be a lot of cigarettes, right? A lot of tobacco, tars. You would consider that person a heavy smoker, right? So those who are using cigars, that's how much they're smoking in that 1 to 2 hours. Little cigars are becoming more popular because they're taxed differently than cigarettes. So they don't have as much taxes, so they're less costly. They also have a lot of fruit or candy flavors that attract youth. So each day there's over 2,000 youth under the age of 18 that smoke their first cigar. And then hookah. So it's 500-year-old tradition from Egypt, India, Turkey, the Middle East, right? It's a social activity among their family and friends. Um, it can be single stemmed or multi-stem. And how it works is the smoke is passed through tube into a water basin before it's inhaled. And we're going to talk about that here next as well. But it also comes in different flavors that is very appealing to youth. However, most hookah it uses charcoal to heat the tobacco, and that charcoal adds more carbon monoxide. Um, and then studies of tobacco based and herbal based show that the smoke from both contain carbon monoxide and other toxins. So you may have a patient say, well, I don't use the tobacco base that has nicotine. I use an herbal base. It's still being burned with charcoal and it still has that carbon monoxide in it and other toxins. So it's still not healthy for them. It's just like if you were in a burning building and you came out with no burns, right? What are they worried about? They're worried about your carbon monoxide inhalation, right? So, smoking or breathing that in is not good for your lungs. So, with hookah, it has 4 times more nicotine and tar. So, the amount of a typical hookah session is 90,000 milliliters versus 5 to 600 milliliters on a cigarette. So smoking a 60-minute hookah session is equivalent to smoking 60 to 100 cigarettes, because you have about 200 puffs on hookah versus 20 puffs on a cigarette. And then going back to that water basin, right? So most people think that the going through the water helps filter the smoke. But what it actually does is it doesn't filter it. It just helps cool the smoke down so that you're able to inhale it better and deeper into the lungs. And then obviously Usually that mouthpiece is being passed from person to person. They're sharing that. And we know as dental professionals how gross that can be. It can be spreading herpes, bacterial infections, colds, periodontal disease, cavities, all those things. And then in the Journal of Periodontology, they said that there's 5 times more perio in hookah smokers than in non-smokers. So our next one is called heated tobacco. Um, we'll see a picture of it next here too. It's kind of a hybrid between a cigarette and a vape, right? So it's a heat, not burn tobacco. So it still uses a tobacco stick, like a cigarette, that you put into this electronic device. An electronic device heats the tobacco. So it's not burning it, so you're not getting that carbon monoxide, and you're just getting the vapors off of the tobacco stick. It can be a stick or loose leaf. Um, it can be used to heat cannabis as well. They do come in flavors. Um, and then the user allows the users to inhale nicotine into their lungs. It does contain lower levels of harmful ingredients in cigarettes because it's not being burned, so you're not getting those um, carbon monoxide from the burning, but it still does contain other harmful ingredients that may not be present in cigarettes as well. So this is what it looks like right now. The only company in the United States is called IQOS. So as of February 2022, the FDA has only authorized IQOS and 3 of its tobacco containing heat sticks to be marketed as a modified risk tobacco products. So meaning it doesn't have, it's not as harmful as tobacco, and so it's a modified risk because it's not being burned, right? It's the first product ever to receive that exposure modification order on them. Nicotine gel, I don't really see this anymore. It's not, it was out in like maybe 2007, but it's on the FDA's website, so I still have it on here. Basically, it's like a gel, kind of like a hand sanitizer, but it has nicotine in it, so it can be absorbed through the skin. It obviously is non-combustible tobacco product because it's just absorbed through the skin. Really not that popular of a product. Smokeless tobacco is anything that is sucked or chewed. It does have more nicotine per gram than cigarettes, and it makes it very addictive. It also is appealing to youth because it comes in lots of flavors. Chewing tobacco, it's cured tobacco, can be in loose, leaf, plug, or twists. There's also a dry snuff that's really fine, loose cut powder that's sniffed through the nose. And then there's a moist snuff or snus that's cut tobacco, can be loose or pouched, that's placed in the mouth. And it is very, very addictive. My husband had a coworker who did chewing tobacco, and he asked him one time, he's like, "Why do you do that? It's such a, it's so gross. It's such a nasty habit. They're like spitting all the time." And he said it's because he first tried it when he was a teenager. And he said the feeling that you get that first time is like so euphoric. Like it's such a great feeling. He's like, every time you use it after that, you're trying to get that same feeling that you got the first time, but you never do. But you just keep using it, hoping that you're going to feel that same way that you did the first time that you use it. So it is very difficult. Be very understanding and patient with any of your patients who are using these tobacco products. It is very hard to quit. Okay, now we come to vapes. So the nicotine content does vary from what it says on the package. They're still not regulated, right? So what that says on the package is not necessarily what's in it. And a lot of times we don't know what's in these products. So some of them may state that they contain no nicotine, but they did a study where they took 100 um, different vaping liquids, so e-juices, that said that they had 0% nicotine, and all but two had nicotine in them. Okay, so you can't go based what's on the packaging of these because they're not regulated. All right, so um, some of these have a patented 5% salt nicotine formulation, which leads to more available nicotine without it being so harsh to inhale. Because a lot of these products, it is might be more difficult to inhale. That's why they add like menthol to kind of help soothe your throat so you can inhale it a little bit better. Um, in 2020, the FDA did enforce a ban on the sale of fruity flavors in the pod devices. So basically, in Juul is really the main pod device at the time. So, but they didn't ban it in the refillables or in disposable. So, what did kids do? They just switched from Juul and went to another brand like Puff Bar. And I'm sure there's other brands out there now that they've switched to. It's constantly evolving industry. So e-cigarettes, um, how they work is they make an aerosol based off of a liquid that contains nicotine flavorings and other additives in it. And it can be used to deliver marijuana and other drugs. It's the kids have even used it for alcohol. I mean, there's lots of different things that these kids will experiment with these devices. And most of the time now, when they're found with e-cigarettes in the schools, it's usually has marijuana. So, e-juice. So when they first came out, they were telling these kids that it was water, flavored water, and it was just a water vapor. So they did not know that it had nicotine and other things in it. When they first came out, parents were buying it for their kids because they thought it was harmless, right? But the e-cigarette aerosols do have nicotine, other harmful chemicals and toxins that are known to cause cancer. They have taken radiographic findings and have found diffuse ground glass opacities in those x-rays in their lungs. And then they have found flavorants such as diacetyl, which is no longer in there, but we'll talk about it. Volatile organic compounds such as formaldehyde and heavy metals such as nicotine and lead.
Everything I picked was plus everything you're
Exactly.
Oh my God.
I would never think that.
Today we're going to be spotting the vapes. As you can see, there's a lot of different items that we placed on the table, and we want to hear from you which ones you think are vapes and maybe those that are probably school supplies.
Okay, let's see. That could be one. That could be another one.
Mm-hmm.
That might be one.
Okay.
I like that one.
Mm-hmm.
That one too.
Okay, yes.
I'm gonna stop.
For the most part, you did catch some. Here are some that you might have missed. This sweatshirt here is actually a vape device, believe it or not. You can see here
Oh my God.
that it is a vape
Okay.
device. And then here you can see that this watch right here too, it might look like an Apple Watch, but it's actually a vape device. And right here, believe it or not, this backpack as well. And so you can see how easily it blends in with everyday things that we think that our children use.
Wow, I'm surprised. I didn't think that a watch or a hoodie or a backpack, and much less a pen, could be a vape.
Okay, so I like that video because the argument for vaping is that it's not meant for teens and youth. It's meant for adults to help them quit smoking. But if it's meant for adults, why do you need a backpack? Why do you need a pen? Why do you need a hoodie? Why are you trying to hide it, right? Adults aren't trying to hide their use of tobacco use or vaping. The only ones that are trying to hide it would be youth. So if we look at who is using these products, we look at the blue line is cigarette use for high school students, right? So back in 2010, it's at 17%. It's now down to 2%. People don't smoke. They don't like it. They don't think it looks cool anymore, right? But then you look at this orange yellow line, and that's e-cigarette use. So e-cigarettes came about around 2011, and you can see the spikes. And the highest that we ever had was 2019 at 27.5%. And then that is when we had the change from age 18 to 21 to buy cigarettes, right? Then we saw a huge decrease down to 11.3% in 2021. And it's slowly on the rise again, 2022 at 14.1%. If we look at adults, so adults, cigarettes, 2010 was at 19.3%. 2020, it was down to 12.5%. If we look at e-cigarettes, it started 20, my data goes back to 2014. It was at 3.7%. Had a little bit of a bump there in 2019, but then back to 2020, went back down. It's pretty much stayed the same, right? 3.7%. So we can see here, vaping is not an issue for adults. It's an issue for teenagers.
Come to Marlboro Country.
Must you really smoke?
I love it so very much.
That sucks.
I need a cigarette.
Can I get one of those?
Give me one of those, will you?
Dentists recommend them. Makes your food taste even better.
Remind her not to smoke it.
Don't smoke it, darling. You just have to hold it.
Who got a cigarette there? Anyone got a cigarette at the bar?
So the Truth Initiative, they do a lot of um, things and research on tobacco use, vaping use, and other substances as well. So they're a great resource to find things, but yet one of their main things is trying to fight the imagery that youth see towards cigarettes and vaping. So why is this an issue? So 9 out of 10 smokers, current adult smokers, right? They started by the age of 18. Okay. So before, when they were a teenager, 98% started by the age of 26. So the chances of you picking up a cigarette and being a lifelong user after the age of 26 is pretty low. Not that it can't happen, but most of the time it's going to start before the age of 26 when your brain is still changing and developing. And cigarette companies know this, right? The average age to try a cigarette is age 12. For e-cigarettes, it's younger. The average age is starting around 9 to 10, right? So they're having issues with this in elementary schools. 81% of youth who use um, vapes say it's because of the flavors are the primary reason why they use it.
In a wild turn of events, animals are demanding Juul not test on humans. Mario?
No one knows the long-term effects of juuling, so any human who uses one is being used as a lab rat. Thank you.
Let's hear from Doug the Pug and his fellow protesters.
I will never stop fighting Juul. Or the mailman.
Nicotine is trapping humans in a rolling cycle of addiction. Oh, excuse me.
Thank you, Cupcake. Fact, no one knows the long-term effects of juuling. Do you?
I just like that. I think it's a cute commercial because we don't know what is in it. Um, what it says on the packaging is not what is actually in these products. All right, so what are the health effects? So this is for based off of cigarettes. Okay, so your um, causes are approximately 6 million deaths worldwide each year. Tobacco is the only legal consumer product in the US. If it's used as intended, will eventually kill you, right? But your death certificates do not state tobacco use as the cause of death. So what you're going to find on the certificates are oral cancer, lung cancer, breast cancer, emphysema, COPD, heart attack, coronary thrombosis, heart failure, cardiac arrhythmia, pneumonia, or a host of other diseases, right? When we look at other behavioral um, issues compared to tobacco deaths. Tobacco is twice as many, right? So 480,000 on average per year is from tobacco deaths. So when we compare that to alcohol, that's 8,000 illicit drugs, suicides, car accidents, homicides, AIDS, HIV, and fires. Those are only about half of the deaths per year as tobacco. When we look at tobacco and pregnancy, so if they are using cigarettes while pregnant, can cause miscarriage, preterm births, low birth weight babies, infants with cleft lip or palate, growth retardation, tooth malformation, right, which is important for what we're doing, also cleft lips and cleft palates, and then also SIDS, sudden infant death syndrome. So when we're looking at, who is using tobacco products, when we see our general population, went from 44% all the way down to 12%, right? So of that 12% of the population, who is using cigarettes? And it's really heavily used by people who have mental health diseases and issues. So if we look at people who use illicit drug, they are 98% more likely to also use tobacco, like cigarettes, alcohol use, 93%, schizophrenia, 90%, major depression, 80%, bipolar, anxiety disorders, PTSD, and ADHD. They are all really highly likely to be using tobacco products as well, especially cigarettes. We need to look at medication interactions when it comes with smoking cigarettes and vapes. So tobacco use does reduce the effectiveness of psychiatric medications, right? So if they are taking any of these medications, antipsychotics, antidepressants, mood stabilizers, analytics, anxiolytics and other medications, um, and they're smoking, and we want to try and help them quit smoking, we need them to be working with their doctor because as they quit using tobacco, those medications are going to be working better than they did when they were smoking, right? So it can cause some changes, and those medications might need to be readjusted for those patients. So, if they're going to be, you're going to help them quit their cigarette use and they're using any of these medications, they do need to be consulting with their physician. So, health effects of vaping, um, addictive. I mean, you don't have to vape every day to get addicted. There was a story of a student who got caught vaping in high school by the principal. And the kids just says to the principal, he's like, I don't know why. I'm not a bad kid. I just don't know why I have this need, this urge that I have to smoke. I take a hit on my vape in between classes. He's like, I just can't go throughout the day without getting a hit on my vape. And the principal says to the kid, he's like, well, it's because you're addicted. And the kid just starts crying. Like they had no idea that he could be addicted to something like this. So it is very addictive. Anxiety and depression. Nicotine actually makes anxiety and depression worse. It also can affect your memory, concentration, self-control, attention, especially in developing brains. So the thing about doing these when you're a teenager, your brain is still growing and developing, and these chemicals can change your brain, and it changes it so that you become more addictive to these substances. And people who vape are more likely to start smoking regular cigarettes, and they may be more likely to develop other addictions in the future, especially we talked about how these vapes can be used for other types of drugs as well, not just nicotine based. And then impotence, there's some evidence vaping can cause sexual dysfunction in men, can cause sleep problems, exposure to cancer-causing chemicals, chronic bronchitis, and lung damaging that can be life-threatening.
Our GMA cover story now, a teenager who underwent a double lung transplant after vaping is now telling his story as a warning to others. Paula Farah sat down with him, and this is quite a story. Good morning, Paula.
Quite a story he has. Good morning, Robin. Good morning, everyone. Daniel Ament was a healthy high school student who loved to sail, swim, and run. Then he started vaping. His doctors say his lungs were destroyed beyond repair. This morning, 17-year-old Daniel Ament is recovering from a double lung transplant, believed to be the first related to vaping. About how often were you vaping?
Maybe a few times during the day, but like at lunchtime if I was with people, but it would only be like hitting it once.
Do you buy the vaping pens?
I never bought one. It started off just whenever I'd be with my friends on the weekends, I would just hit theirs.
He began vaping in December of 2018 using mainly flavored cartridges and occasional THC pods. And in early September, he started feeling ill.
I had a really bad headache. That was my main thing. And I just felt really sick.
His mom, Tammy, had an idea the illness was vaping related.
On the way to the hospital, I said, are we still going with the fact that you've never vaped or you don't vape? And he said, maybe.
Daniel didn't come clean until he was admitted to the hospital.
It's really frustrating, and I know that the kids, I think they cover for each other.
Once in the hospital, he rapidly declined and was put on life support for 29 days. When they're telling you what happened and that you were days from dying.
Yeah, that still hasn't really processed yet. It's really hard to believe that that happened, but everyone's told me that one day they just said he has a 10% chance to live.
On October 15th, after doctors told his family death was imminent, Daniel was given a double lung transplant. In these dramatic before and afters he shared with us, Daniel's lost over 40 pounds. He showed us the surgery scars on his neck and across his chest. When the doctors told you that this was because of vaping, you were skeptical.
Yeah, I didn't really believe it at first. It just didn't make sense because why didn't it happen to other people that had been vaping for years, why didn't it happen to someone else close to me that I was hitting their stuff? So how did the chemicals affect me and not them?
This is your new normal.
He says while he is grateful to be alive, his new life is forever altered.
Like, I have to take over 20 medications a day. I have to wear a mask in public for at least a year. I can't travel for a year. Opportunities that I would have had before, like going in the military, I can't do that anymore.
You feel like you've been given a second chance?
Yeah, for sure. And I want to make the most out of that and make sure no one else makes the same mistakes I did.
And Daniel's lifelong dream of being a Navy SEAL won't happen now because of the transplant, but he's using his voice. He's launched a nonprofit called Fight for Wellness. He wants to advocate for other youth in the country to warn them about the dangers of vaping. But, you know, so often teens are lying to their parents about it. He lied to his parents until they got to the ER, but they'll talk to one another about it.
Oh, and hopefully they're going to be listening to him.
Yes.
And his message.
As you say, take your mess.
Make your mess your message.
Yeah, exactly.
And he's doing just that.
Yep.
All right, Paula, thank you very much. Well, hey there, GMA fans. Robin Roberts here. Thanks for checking out our YouTube channel. Lots of great stuff here. So go on, click the
Okay, so, back in 2019, we started to see a lot of these youth come down with this disease from vaping, and we called it EVALI. So e-cigarette and vaping associated lung injury. So it can develop over a day to several weeks. It's not caused by a lung infection. They suspect that it was vitamin E acetate that was the chemical of concern, and most, but not all, reported a history of using the THC containing products. There were 68 deaths reported from September 2019 to February 2020. And then reporting stopped after that because then obviously we had COVID in March of 2020. And so they stopped tracking EVALI. But some of the symptoms, it can be a gradual start of symptoms, including breathing difficulty, shortness of breath, chest pain before hospitalization. It can be mild to moderate gastrointestinal illness, including vomiting and diarrhea. They could have fevers, weight loss, or fatigue. Many patients did require supplemental oxygen with ventilation. Some were intubated. Some patients were treated with corticosteroids. Antimicrobial therapy was not associated with improvement because it was not due to an infection, right? So a lot of times, like these chemicals, even if it's approved, say like the flavors, right? They are food grade, approved for ingestion. However, like our lungs are not meant to process and break down chemicals and food flavors. Like our lungs are meant for oxygen exchange. And so when we put these things into our lungs, it gets trapped there. Our lungs aren't able to get it back out of the lungs and it gets trapped.
I thought vaping was fine. I did all the tricks all the time.
A month ago, you'd find Maddie vaping every day, posting pictures and video on social media.
I used I thought vaping was fine. I did all the tricks all the time.
A month ago, you'd find Maddie vaping every day, posting pictures and video on social media.
I used all sorts of different products, like from all sorts of vape shops across Utah County, and I used Naked Juice, all sorts of name brand juices.
Products with either no nicotine or a lower dose of nicotine. Today, these are her pictures on social media instead, in a medically induced coma in the hospital.
The doctors said that it was definitely from vaping.
Maddie says she became mysteriously ill in late July.
My temperature was so high, my brain just completely shut off, but I thought I was in the Payson Hospital for one night and I was actually there for 4 days.
From there, she says she ended up at Timpanogos Regional Hospital in the ICU for 3 days. Doctors would figure out
I had fat particles growing inside my lungs that were related to the glycerin in vape juice. So, and then my lungs were full of fluid, and they said that my chest x-rays was one of the worst that they've ever seen.
How they explained it to her family.
When you inhale the moisture, that is just creating the perfect environment for bacteria to grow inside your lungs and for infection to start, and that is basically what happened.
It's similar to what the Utah Department of Health has been reporting. Nearly 24 cases of teens and young adults with severe lung disease in Utah. All the cases, just like Maddie, ended with severe illness and hospitalization.
My family seriously thought that I had passed away, and when I found that out, it just made me so sad.
A few weeks later, you can see Maddie is doing much better, though.
It's very scary because the doctors don't know the long-term effects of this, so they don't know what the healing process is even supposed to be like.
Maddie still needs to use oxygen at night, but she doesn't need this.
After going through that, I would never touch a vape again.
Now, in addition to all of the medical stuff, there's also a financial burden here. After her stay here at Timpanogos, Maddie says she's now in a lot of medical bill debt. Now, the Utah Health Department, who I spoke to yesterday, told me that they're testing products in vapes and also cartridges to see what might be causing people to get sick. Live in Orem, Lauren Steinbrecher, Fox 13 News, Utah.
So, we'll get back to a lot of things that she talked about, like the glycerin and things like that as well. But so recent studies have showed that e-cigarettes are most likely to interfere with surgical wound healing. So this implies that it would interfere with healing from extractions or periodontal therapy, right? A new study shows it affects the endothelial cells in the cardiovascular system. And just a single vape can be harmful to your blood vessels, even when it's nicotine free, because it has all those other additives and chemicals in it, right? And then stem cell study determined that the flavors of cinnamon and menthol are the most toxic flavors. And that vape flavor might be more harmful than the nicotine itself. Because like we talked about, your lungs are not meant to digest those types of things. It's meant for oxygen exchange. So we're going to talk about popcorn lung. So the diacetyl, it was used in e-juice. I believe that it's not used anymore, or very few still use it. It was a chemical found in the butter flavoring in microwave popcorn. And so what they found that the workers in the plant who of the butter microwave popcorn plant were coming down with this mysterious and rare lung disease. And also, the workers in the plant manufacture of diacetyl were developing the same type of lung disease. So they found that there was a relationship between the exposure of diacetyl vapor and this abnormal lung function, which when you look on an X-ray, it looks like popcorn in the lungs, the way it appears. So that's why it's called popcorn lung, also associated with the microwave popcorn butter flavoring. So vape devices are very harmful as they can explode.
A Pocatello, Idaho man says an e-cigarette exploded in his face and that he lost 7 teeth and has second-degree burns because of the incident. This is Andrew Hall. He says this all occurred in his bathroom Sunday morning. There he is at the Portneuf Medical Center after the explosion. This is the e-cigarette that he says caused all the damage, not just to his face, but also to his bathroom. Part of the sink gone, as well as burns all over the walls. Now, Hall posted about the explosion on his Facebook page. It has been shared nearly 450,000 times and reported in media worldwide. So far, as of Wednesday morning, over 250,000 comments have been written on his Facebook page, many expressing sympathy, others doubting his story. But Hall claims that this did happen, and Portneuf Medical Center confirms he was released from the hospital on Monday. EastIdahoNews.com has contacted Hall for an interview, but our requests have not been answered. Since e-cigarettes were first introduced on the market in 2007, there have been several reports of them exploding. As for Hall, he says he looks forward to going back to work, and he thanks everyone for their prayers and support. I'm Nate Eaton for EastIdahoNews.com.
So they have been tracking battery explosion incidents. This is on the U.S. Fire website, so the nfpa.org. And e-cigarettes were most likely to explode while in your pocket. 61 devices in use was 60, battery being charged 48, storage 18, not reported where it occurred was 7, and then while being transported was 1. And so you can, I'm not sure how often these statistics are updated, but it is a concern. The other thing that we want to talk about is the nicotine that's in these devices. So 1994 was classified as an addictive drug. And how it works is it acts on the receptors in your central and peripheral nervous system that results in that addiction. Absorption of the nicotine does depend on the pH of the environment. So, cigarette companies, vaping companies, they make the pH of their products the same pH as your oral cavity so that it will absorb quickly. Um, and then it is a powerful poison and pesticide. So nicotine is a natural chemical in the tobacco plant and other plants, and it acts as a natural pesticide for insects so that they don't destroy the plant, right? Nicotine also can be a poison. And so poison control calls since e-cigarettes were came about on the market has increased. So before 2011, when they would get calls for poison control, it would be for usually young children or pets who might have eaten a cigarette filter or eaten a cigarette. Um, but since then, it's increased because with e-cigarettes, that liquid, it tastes good, tastes like candy. So it can be absorbed through the hands. They can ingest it if it gets in their eyes. Like there's a lot of different ways for this liquids to be ingested into the body, and the amount of nicotine in them is a lot higher. So they've been getting, you can see over time, the increase of calls for poison control because of e-cigarettes. So signs of mild nicotine poisoning would be nausea, vomiting, dizziness, tremors, sweating, tachycardia, and high blood pressure. Severe poisoning can be life-threatening and can lead to seizures. And seizures can begin in as little as 20 to 30 minutes after ingestion or absorption. So we want to talk a little bit about nicotine withdrawal versus anxiety. So, one of the reasons why people use cigarettes or nicotine is because they say it helps with their anxiety, right? Well, withdrawal symptoms look a lot like anxiety, right? So if you're having withdrawals from nicotine, you might be feeling frustration, restlessness, difficulty concentrating, irritability, anger, insomnia, a depressed mood, increased appetite. And if you look at anxiety, a lot of those are the same, right? So if you're feeling those things, you take a hit on your cigarette, you're gonna feel better. Now, did you help your anxiety or did you help the withdrawal symptoms? So that's something more to look into. I'm guessing you're more likely helping those withdrawal symptoms than the anxiety. And there are those who say that after increasing their vaping or using vaping, their anxiety actually became worse and not better. We'll watch a few of those stories later here as well.
I wish
Okay, so moving on to talk about secondhand and thirdhand smoke. So, secondhand smoke, you have what's called your mainstream smoke, which is coming out of the user, and then your side stream smoke, which is what's being coming off the end of the cigarette when it's being burned, right? So, with secondhand smoke, the smoker only gets about 16% of the toxins. So, when they're breathing out that mainstream smoke, they're sharing 84% of the toxins in the air. Um, 41,000 non-smokers die every year from secondhand smoke. It can cause diseases in non-smokers. So separating smokers from non-smokers in the same space doesn't eliminate exposure. It's like if you're in a public pool and somebody pees in the pool, right? It's not staying in that one area. We're all getting that toxin. Okay, so it's all in the air. Everybody's getting it. You can't separate it. And then from 1964 to 2014, 2.5 million people died from exposure to secondhand smoke. Um, okay, so secondhand smoke, it can lead to asthma attacks, respiratory infections, ear infections, especially in children, and SIDS. Coronary heart disease, stroke, and lung cancer. It is a class A carcinogen, meaning that there are no safe levels of exposure, and it does contain hundreds of chemicals that are known to be toxic and carcinogenic. Now, when we talk about third hand smoke, we're talking about where that smoke in the air lands on objects, right? So carpets, drapes in your car, rugs in your AC unit, your furniture, okay? It does resist normal cleaning and it can remain on fabric for a year and a half after the last exposure to cigarette smoke. And a longitudinal study looked at secondhand and thirdhand smoke in a casino. They found extremely high levels of residue on surfaces and in the dust. And after a 1 month smoking ban, surface nicotine decreased by 90%, but the nicotine and tobacco specific cancer causing chemicals in the dust decreased more slowly, declining by 90% only after 3 months. And infants and children are more susceptible to this, right? Especially they're usually the one playing on the carpet, crawling around on the carpet, and when their skin touches those carcinogens and those toxins, it's absorbed through their hands and their feet and their skin. Same with pets, right? So some people don't have kids, but they really love their pets. And when their pets are crawling around, walking around on those surfaces, and then they're licking their paws and licking themselves, they're ingesting those toxins, and that can also cause diseases in your pets. Okay, moving on to the oral effects of vaping. Okay, so is a list of all of the oral effects that we're going to be talking about, right? So tobacco stains. So tobacco tars and chemicals, they cause discoloration, staining. Um, it often stains dentures and non-metallic restorations, and it's very difficult to remove, right? And sometimes it can be impossible to remove, especially if they have that recession and it gets embedded into that cementum. It's very, very difficult. Here we have necrotizing periodontal disease. So, smoking tobacco is one of the main factors associated with periodontal disease. Other factors include poor oral health or hygiene, emotional stress. One study reported that smoking contributed to 98 out of 100 cases of necrotizing periodontal disease. So when we think of necrotizing periodontal disease, it was really common when, right? They call it trench mouth for a reason. So it was really common during World War II. What was going on during that time, right? They were young men in very stressful situations, low nutrition, and we know at that time cigarettes were handed out they were issued to them, right? So there was a lot of smoking going on at that time as well. So all those things contribute to necrotizing periodontal disease. Black hairy tongue, it is most extensively in heavy smokers. So it's abnormally thickened and elongated papilla. So basically those chemicals in the tobacco, it coats the tongue and it doesn't allow the cells on the papilla to slough off normally. So it just stays on there and it becomes elongated, right? It can cause a burning sensation on the tongue, definitely halitosis, and sometimes can trigger a gag reflex in the patient and probably also you when you see it, right? It's not pretty. Brushing the tongue and quitting tobacco will produce a healthy tongue. So it does come off if you teach your patient how to clean it properly. And then obviously by quitting tobacco, that's going to eliminate those chemicals from keeping those cells from sloughing.
Nasty side effects like black hairy tongue. Just another way dipping does you dirty.
I just think that's a silly video. Anyway, okay, dental caries. So the sugar content in chewing tobacco can vary from different brands, but it can be anywhere from 2% to 35%. So if you're thinking of somebody who's using chewing tobacco, they're putting it in their mouth and just letting it sit there for hours, right? Before they spit it out and put in another wad for hours. So your teeth are constantly being bathed in sugar, which is obviously not going to be good for your teeth when it comes to cavities. Then there have been a study on the relationship between chewing tobacco and dental caries, and it found that they were as 4 times greater to get cavities when using chewing tobacco. And then children who are exposed to secondhand smoke are twice as likely to have caries than children who aren't exposed to that. Tobacco melanosis, it can be mistaken for normal pigmentation, um, but the melanin pigmentation that occur in the attached gingiva is 5 to 10% of smokers. It can be dose and heat related. The condition is reversible when smoking is discontinued. There is no clinical significance of the known risk, but it's not known to occur in chewing tobacco, and so that's why they believe it is heat related. So this is severe tooth abrasion caused from long-term chewing tobacco use. Chewing tobacco has a lot of grit that floats around in the mouth while you're eating and speaking, and that causes that abrasion of the teeth. Implant failure. So smoking is linked to implant failure. It affects the cells that are involved in wound healing. It has the vasoconstriction properties of nicotine, and it decreases the tissue perforation. It also reduces alveolar bone supply, and bone formation is compromised by the nicotine exposure. Nicotine stomatitis is most often seen in pipe and cigar users. It does not have significant pre-malignant potential, but can turn into oral cancer. So it's definitely something that you want to keep watching. And if you see any changes, you want to refer them for biopsy. A localized recession can be due to chewing tobacco because where they place the chewing tobacco is usually in the same spot, and so that can lead to recession. You have snuff keratosis also because where they are putting that chewing tobacco is usually in the same place. It is considered precancerous and is more prone for malignant transformation, so it shouldn't be neglected. You should keep an eye on it. A biopsy should be performed if there's any evidence of erythema or ulcerations. 98% of patients that oral mucosa will resume to normal within 2 to 6 weeks after they stop the habit. You can also encourage your patient to move the chewing tobacco into a different location so that it's not causing that irritation in the same spot. Erythroplakia is known to have precancerous potential due to the numerous cases that were diagnosed that progress to carcinoma. Biopsy is essential for this. It's that bright red velvety plaque that can't be characterized as any other condition, and it's usually asymptomatic. You have leukoplakia, described as a white lesion that can't be scraped off or characterized as anything else. It can appear uniformly white with a smooth or corrugated surface. Tobacco is considered to be the leading cause of this development in the oral cavity. And since it's not always discernible with a clinical eye, biopsy is recommended for this. All right, so periodontal disease, tobacco is a stronger risk factor than 5 of the most commonly accepted pathogens. Okay, so if they are smoking, they're more likely to get periodontal disease than if they had any of the bacterial pathogens that cause periodontal disease. Also, nicotine is a vasoconstrictor, so you get that reduced blood flow to the periodontium. And smokers have more severe and extensive perio due to increased pathogenic microorganisms. Because when you're smoking, the acquired pellicle and biofilm become more sticky, so you're going to increase the amount of pathogens and microorganisms. And smoking causes inflammation and impaired immune function. And that's according to the Surgeon General report of 2014. And even secondhand smoke is linked to periodontal disease. Right, so oral cancers. One person in the US dies every hour of every day due to oral cancer. So half will be alive in 5 years after diagnosis. So there's two very distinct pathways. Um, Tobacco is 80% and alcohol is 70%. And then people who smoke and drink, their risk is as high as 100% more than those who do not smoke or drink. So you want to teach your patients how to check their mouth, right? So by the time of diagnosis, 70% of cases have already spread to the lymph nodes and result in poor prognosis. That's why only half will be alive in 5 years after diagnosis, because it usually doesn't get diagnosed early enough. So, but the good news is oral cancer is 80 to 90% curable if it's detected early. Bad news is that we don't normally catch it early. And um, it does occur in men twice as often as women. Um, Other cancers have improved survival rates because of early detection and self-exams, right? The medical industry is really good at teaching people how to self-diagnose and do self-exams. So as dental professionals, we can be better at this and be part of early detection and teaching our at-risk patients how to do self-exams, right? So anything in your mouth, teaching them that anything that's in your mouth should heal within 2 to 3 weeks. If it's not going away, it needs to be evaluated and looked at, right? So squamous cell is 90% of all oral cancers. It is only discovered when it has metastasized to another location, usually the lymph nodes of the neck. Patients who survive a first encounter have up to 20 times higher risk of developing a second cancer. And this risk can last for 5 to 10 years after the first occurrence. With lip cancer, it's a sore that doesn't heal, persistent lip pain or lip numbness, a lump or thickening of the lip, white or red patch, and a neck mass. So I actually do have an experience where I found cancer on a patient, and it was on her lip. It might have looked somewhat similar to that, but it was on her upper lip, right on the like vermilion border. And to me, I didn't think it was cancer, but it didn't look normal. And the patient said it had been there for a while and it wasn't healing. And so we sent her to the oral surgeon to have a biopsy, and it came back that it was cancer, and we were able to catch it early, and was able to recover, and she was very thankful um, that we were able to catch that for her and save her life. So oral cancer warning signs. So erythroplakia, leukoplakia, a sore throat that does not heal, lump or thickening of tissue, chronic hoarse throat, difficulty chewing or swallowing, and ear pain. Um, I actually saw a patient in clinic uh, with a student that we were doing our EOIO, and it looked almost exactly like this, but it was closer up behind his ear. And when we asked him about it, he said that he thought it was because his football helmet rubbed in that area and caused a bump. Um, but we explained to him that his football helmet might have been rubbing on it because it was already there. Highly encouraged him to go see his doctor. Um, Talking to the student after, she said that, during the appointment, he was really worried about it. So I think that he would have gone to see his doctor. I don't know the follow-up on that, but I'm hoping that he did get it take looked at because it looked exactly like this picture. It was that big. I also had another patient in a dental office that I had seen him for a cleaning about a week or two before. He comes back in and said that he was just diagnosed with throat cancer. So, me and the doctor take him back. We're trying to look again to see if there was anything we missed. We could not see anything. So, what happened was that he had had a sore throat for months and it just was not going away. So, he goes into his doctor. They finally take an x-ray of his throat, and that's where they found the cancer in his throat. But it was so far down his throat, we could not see it in the mouth in the office. But that just goes to show if somebody is having anything within the mouth or surrounding tissues that is not healing, we definitely want them to follow up on that. When in doubt, refer out.
I had my first cigarette at age 13, and at age 17 is when I really started smoking on a regular basis. And then in 2000 is when I found the little sore on the inside of my mouth, and it wouldn't go away. When on a routine dentist appointment, he saw it and he thought it looked suspicious, so he did a biopsy. Well, it came back as mouth cancer. So I had to go through radiation. And then in December is when we discovered the tumor in my larynx. The day of my surgery, I can remember smoking up to the front door of the hospital. That's how addicted I was. And I didn't know that I was so addicted until after I got out of the hospital. When I went home, I went to like, I went straight to my bedroom, picked up a cigarette, put it in my mouth, and lit it. And for the first time, I really looked at myself in a mirror. And I thought, Terry, what are you doing? You have a hole in your neck, and you're getting ready to use what did it to you. My advice to somebody who doesn't smoke, don't ever start. My advice to those who do smoke, please quit, or at least try.
Okay, so vaping oral effects. So here is a list specific to just vaping. So xerostomia. So the propylene glycol is one of the major ingredients in vaping liquid or e-juice. This is also the story of the girl from Utah. That glycol is what got into her lungs and was causing infections and inflammation. So the propylene glycol, it does break down into acetic acid, lactic acid, and propionaldehyde. So these chemicals are toxic to enamel and tissues, and also water molecules bond to propylene glycol, and that's what can cause the dry mouth. So dental caries, so vegetable glycerin with flavorings, they have a fourfold increase in microbial adhesion. The vegetable glycerine with flavorings also has a twofold increase in biofilm formation. So there's a 27% decrease in enamel hardness when flavorings are added. And the viscosity of the e-liquid also allows Streptococcus mutans to adhere to pits and fissures. So not only are they more likely to get cavities, between the teeth where we normally see it where they're not flossing, but also in those pits and fissures. So it would be important for placing sealants on these teenagers who you suspect might be using um, e-cigarettes or vapes. So periodontal disease, again, nicotine affects the blood flow as a vasoconstrictor. It affects cytokine production, neutrophil function, and other immune cell functions, which we know is really important in periodontal disease to help fight off those pathogens. And then nicotine decreases your connective tissue turnover as well. So quitting is a process. It's not an event. It is very difficult. Even we saw that story. She had just come out of surgery, and the first thing she does is she goes to pick up a cigarette to start smoking again, right? It is very, very difficult to quit, and it may not be successful in the first attempt, and that's okay. We take that first attempt as a learning process of what can we do better the next time.
My name is McCall Mirabella, and I am addicted to nicotine.
Teen YouTuber McCall Mirabella is going viral after posting about her difficult experience quitting e-cigarettes cold turkey.
I was seeing more and more stories about kids my age being hospitalized because of lung illnesses due to vaping.
The 19-year-old says her decision to kick the habit started with a $3,000 bet with a friend at the beginning of the year.
If I could make it to December, I was going to donate the money. And I'm doing that because I want to prove that I'm quitting for myself.
But she says she never imagined just how hard it would be to let go of her Juul-flavored nicotine.
This is so hard. I feel like I'm at war in my body. My throat hurts, my head hurts, I'm craving it.
When I quit, I was super hungry. I was eating all the time. I was nauseous. I threw up a couple times. I was super emotional and irritable, and I was definitely more anxious.
Doctors caution McCall's more severe withdrawal symptoms are uncommon and are urging that stopping e-cigarette use is far healthier than continuing the habit.
Cravings, of course, can be triggered by a variety of emotions or visual cues. Withdrawal symptoms do not last forever. You get through them and they go away.
Recent studies show roughly 1 in every 9 high schoolers and 1 in every 35 middle schoolers use e-cigarettes.
We've seen studies in humans and in animals that link nicotine exposure to impairments in thinking and cognitive function, and also increased impulsivity.
Last month, the FDA banning Juul products from store shelves, but that ban on the most popular e-cigarette company temporarily paused. Juul telling ABC News, "We do not want any non-nicotine users, especially those underage, to try our products as they exist only to transition adult smokers away from combustible cigarettes." McCall says she is now 5 months without nicotine. Her message to other teens, despite the pain of quitting, it is worth it.
Okay, so to try and help our patients who are ready to quit, it's going to take both providers and the tobacco user to be persistent. Tobacco use independence requires repeated intervention and long-term supports to help patients quit. Studies do show that it can take anywhere from 2 to 14 quit attempts before they are successful. So slips and relapses are normal. And we want to let our patients know that it's normal because they can start to feel very frustrated if it's not working and then give up. So 70% of tobacco users do want to quit. 50% try to quit each year. but only 5% are successful without assistance. So healthcare providers can more than double their successful quit rates. Um, People are more likely to listen to a healthcare provider than they are from their family and friends, right? So it doesn't have to take a long time. Interventions can last, less than 3 minutes, just to increase overall tobacco abstinence rates. Every tobacco user should be offered a brief intervention, even if they're not referred to like a quit line or a more intensive intervention. So, according to the Surgeon General report in 2000, advice from healthcare professionals to quit smoking has increased. 4 out of every 9 adult cigarette smokers who saw a health professional during the past year did not receive advice to quit. Okay, so as dental professionals, we do have an opportunity to take the lead on that issue, and ask every single time that they come in to the dental office, right? So those interventions from you has a way more impact than family or friends, right? So um, 3 out of 4 of my brothers started smoking. And even though I've worked for the public health department in their tobacco office, and I know all the, quit lines and everything that they should do to quit and all the reasons why they should quit, do they listen to me as their big, older, bossy sister? No, right? But hopefully, if they went to a medical provider, dental provider, they would get some advice and maybe be more open to listening to that advice than they would from their sister. So, the recommended model in public health is ask, advise, refer. So, ask about their tobacco use. It's on their medical history, right? Document their tobacco use status. What kind, how long, how much are they using? There is an ADA code for tobacco counseling. It's usually not paid out by insurance, but if you do give them counseling, you can still put that code in there. So it's documentation that you did do that counseling. Then you can advise them. So advise the patient to quit. Just give a clear, strong, personalized message to every tobacco user. So what is that person's motivation to quit? And then capitalize on those teachable moments with those patients. So an example is my boss was talking to a lady one time and said, what would you do with all that money if you weren't buying cigarettes with it? What would you do? And she said, well, I would want to take my son to Disneyland. And so he's like, okay, well, if just set it every time you would go buy cigarettes, just put that money aside. And then by the end of the year, you should have enough. And so she did that. And so anytime she would want to go buy a cigarette, she would just take that same amount of money and put it aside. And then, if she relapses once and buys a pack of cigarettes, that's okay. She can just get back on her quit attempt. And yes, she made a mistake once, but she's going to get back on it and put that money aside. And by the end of the year, she was able to save enough money and she was able to take her son to Disneyland. So it's finding that clear, strong message that's personal to that patient. Then you can refer them to their free quit line. So in Texas, it's 1-877 yes quit. There's also a Texas Tobacco Quit referral fax form, and there is a Texas Tobacco Quit Line referral portal. So we're going to go through each one of those. So the Texas Department of State Health Services does provide a Texas Quit Line. The Quit Line combines an online and phone counseling program with lots of tools. They have counseling services in over 100 languages. Their professionals are certified. They get over 200 hours of training. They specialize in how to help people quit. And then nicotine replacement therapy may be available for some of those providers as well. It is free. It's available 24/7 to Texas residents 13 years of age or older. The nicotine replacement therapy is either the patch gum or lozenge to callers who are enrolled with a coach, and they must be 18 years or older to receive that. So the Yes Our Quit line does treat teens who want to quit vaping. Youth 13 to 17 years of age are permitted to participate in the tobacco cessation counseling without parental consent. So DSHS promptly notifies their contractor of any change in any laws or regulations around youth that are participating in that program as well. So the first step in referring patients to the quit line is you want to make sure that they're ready to quit within 30 days. So if they're not ready to quit within 30 days, then you don't want to refer them just quite yet. Okay. There are several tools that I'm going to show you in the next page here. There is a mobile app as well. And then there is still a paper fax or electronic methods to refer the patient to the program. So we have your quitline fax form. If you still use faxes, that's there. There is an online referral portal. So this would be for medical, dental professionals. You would click on that link for the referrals, fill that out with the patient information, and then the Texas Quitline will call the patient. There is also a Texas Quitline app which is similar to the online, where you can fill out the information and then the quit line will contact that patient. So here are the FDA approved quit tobacco medications. So you have prescription only medications, which would be a nicotine inhaler. It's kind of similar to like an asthma inhaler where the medication's in there, and then you would use it kind of like um, a cigarette, except it's not being burned, and it's more like an asthma inhaler. You have a nicotine nasal spray, which you can spray up your nose. You have Chantix, which um, is a prescription, and then that blocks the nicotine receptors. So if they are using Chantix and try to smoke at the same time, they won't get the same euphoric feeling because the Chantix is blocking um, those receptors. And then Zyban or bupropion is a antidepressant. Then you have over the counter, which is the nicotine gum, patch, or lozenge. So how it works is nicotine replacement therapy is meant to take the edge off of the withdrawal symptoms. Sometimes the withdrawal symptoms are so severe that the patient will give up trying to quit because they just can't take the withdrawal symptoms. So this is where your nicotine concentrations. So the green line here is on a cigarette. So they take a puff of cigarette and they get this immediate spike of nicotine into their system, right? With chewing tobacco or moist snuff, that's the blue line. It isn't an immediate spike, but they do get a spike over about 30 minutes. Not quite as high as a cigarette, but pretty close. And then we look at the other red, blue lines here at the bottom. Those are your nicotine replacement therapies. So it's giving you just enough nicotine to help take the edge off, but you're not going to get those high spikes that give you that euphoric feeling. Another place that you can get more information is on the ADHA website. They have a lot of resources to help your patient stop using tobacco on their site as well. And then here's my resources. And if you have any questions, you can always reach out to me here.